report. I've checked my chart. I've gathered all my supplies and stuff. I have my stethoscope. I have my little box for tricks here that I can use and check things out on my patient. I've got my pen light. So I've washed my hands. Knocking on the door. Hi. My name's Jan. I'm going to be your nurse for today.
Okay.
I'll be with you until 7 o'clock. Okay. Can you tell me your name and give me your date of birth?
Terry Farno, 12/1980.
Awesome. Can I check your wristband? Thanks. Perfect. So, is it okay if I call you Terry?
Mm-hmm.
Okay.
I actually prefer instructor.
Okay, instructor. gotta respect what our patients' wishes are and stuff. Okay, so I'm gonna raise the bed up to my level. I'm gonna provide privacy and everything. And I'm gonna explain what I'm gonna be doing. I'm gonna be doing several assessments on you.
Okay.
I'm gonna be listening to your heart and lungs. I'm gonna be checking you for, coordination when you're walking and stuff like that, and just kind of checking your back and hip alignment and things like that. So, and I'll be asking you some questions at different times, but nothing real painful or anything like that, okay? So when I'm listening to your heart and stuff, I'm gonna have you kind of be quiet during that time, so I can really hear the heart sounds. Doesn't mean anything's going on, it's just, me listening, making sure to check everything, okay? So if you have any questions during anything at this point in time, just let us know.
Okay.
Or let me know as I'm doing it.
Okay.
Okay? So I'm gonna start off with everything on the front side, and then later on I'll have you sit on the side of the bed and I'll check the back side of everything, okay? So the ears are in. So when you guys are doing this, you're gonna have your stethoscope just like this, not in your ears. Okay, first of all, I'm gonna start out checking, I'm gonna listen to your heart. Checking over here, this is the second intercostal space on the right. I am hearing the aorta, aortic valve crossing over, second intercostal space on the left. I'm hearing the pulmonic. Down third intercostal space is the Erb's point. I'm also catching the left dub, which is the S1 here at the bottom, S2 up at the top. That is giving me the closure of the AV valves and the sublunar valves. Coming down, fourth intercostal space on the left is the tricuspid. Coming on around, fifth intercostal space underneath the breast, mid-clavicular, is the mitral valve. Also, right at this point in time, I'm feeling for the apical pulse, and that is present. Down below is the apex of the heart. Up top is the base of the heart. The heart sits mainly on the left side. It starts at the second intercostal space on the right, goes all the way down to the fifth mid-clavicular intercostal space on the left. When I'm listening in here, I was also inspecting, there was no pulsations or anything like that. Can kind of percuss up here. And I'm hearing resonant. Not feeling anything when I'm palpating, not feeling any lumps or anything like that. Gonna start checking your pulses. I'm coming up here temporal, coming here carotid, on down, brachial, both sides, radial, both sides, ulnar, both sides, femoral, down popliteal, checking both sides, comparing, also coming down, checking post-tibial present, pedal pulse present, I'm down here. I'm going to be checking all the toes, capillary refill. I'm checking for any signs of edema. No edema noted. I'm looking at the color of it. The color is appropriate for necessity. The skin is warm. There is no problem with any edema or anything like that. I'm going to ask you some questions, Terry. Can you tell me if you have any pain in your extremities?
Nope.
Okay. Any numbness, tingling?
Nope.
Okay. And we've already verified pulses are present, no pain, no paralysis because she's able to move all extremities equally. Pulses present 2+ bilaterally, and no paralysis. Okay. Next thing I'm going to be doing is looking and starting with the respiratory assessment, inspecting. When I walked in, I looked at her lips. They were pink. There was no signs of cyanosis, no blue or anything like that. She's not having any issues with nasal flaring. She's not using any accessory muscles like this with chest expansion. I'm looking at her. Her AP diameter is 2 to 1. I'm going to go ahead and start listening to your lungs anteriorly. Okay. I can only listen anteriorly to 5 areas. I'm going to start out here to the top. I'm getting the bronchial breath sounds right along here. Then I'm coming down, bronchiovesicular, and then coming around, and I'm getting vesicular. Okay? I did not notice any crackles, any rales, any wheezes, or anything like that. The next thing, I can percuss anteriorly, but I'll mainly do that on the posterior side, because then that way if there was any issues, then I come back up and do it. Inspecting is the main thing that we do, and also I can have palpate for tactile firmness. Can you say 99?
99.
99?
99.
And then I can come around here, 99. Okay, the next thing, chest expansion. Take a deep breath. Okay, and my thumbs went up and came back down equally without any lag or anything like that. Next thing I'm going to do, I have a question for you, Terry. Have you gone to the restroom recently?
No.
Oh, okay.
Yes.
Oh.
What do you want to hear?
Okay. Well, I'm going to be checking your abdomen.
Okay.
And I didn't want to be causing you any
I'm good.
discomfort. Okay. And can you tell me when was your last bowel movement, please?
This morning.
Okay, great. I'm going to put the head of the bed down. Okay. I'm going to come. We already have privacy provided. I'm going to keep your blanket. I'm not going to raise up your shirt.
Thanks.
Okay. I'm gonna raise your gown up to here to expose the abdomen, and I'm gonna pull your sheets down to here to expose the lower abdomen. Okay. So, have you had any issues with any nausea, vomiting, any pain, discomfort? Okay. So, first off, I'm going to stand to the side. I'm just inspecting. I do not see any incisions. I do not see any striation, ecchymosis. I don't see any pulsations or anything around the abdominal aortic or around the kidneys or anything. So, I don't see any, I said stretch marks, yeah. Okay, so the next thing I'm going to do after inspecting is I'm going to start listening. I'm starting in the right lower quadrant of the abdomen. I'm going to listen at least 5 minutes or until I hear bowel sounds. Reason for that, once I hear the bowel sounds, then I can move up to the right upper quadrant of the abdomen, left upper quadrant, down to the left lower quadrant. If I do not hear bowel sounds, I have to stay in each quadrant for a total of 5 minutes for each one, which equals to 20 minutes until I can make a phone call to the doctor and say no bowel sounds are present. The next thing I'm going to be doing is the percussion. Again, the same way. I should expect to feel tympani. I will have up over the liver, the gallbladder, pancreas, it will be a dull sound. And I'm just going to tap around on all. In the right lower quadrant, I need to name two things. Two organs in the right lower quadrant. I'm going to have the appendix and the right ureter. I'm not going to have a spermatic cord because of the fact that I have a female. Then I'm coming right up, but you guys will tell us you found a cord, palpated a cord in your female patient. Coming up to they do. They will say it. Coming up to the right upper quadrant, I am going to be able to palpate the liver and the gallbladder. Going over to the left upper quadrant, I'm going to be getting the, oh Lord, it just went, spleen and descending colon, yeah. And then coming down into the left lower quadrant, I'm gonna get a continue with the descending colon, but also the sigmoid. Okay, so we checked all of that. The next thing, I'm gonna palpate. And please let me know if you have any issues or you have any pain or discomfort. I mean, checking around. To me, palpating is like kneading, okay? Come up to the right upper. It's like a cat getting their bed ready. Watching my patient for any grimacing, watching for any guarding, anything like that, and then coming down into the left lower. Okay, so that completes that of that. Now, you know what, Terry? I'm gonna go ahead and I've already got all of the anterior cardiac, your abdominal, and also I'm going to be talking about what bowel sounds I heard. I heard bowel sounds were within the right amount, 5 to 10 per 2 or 3 minutes when I was listening. I didn't hear any hypo or hyper bowel sound, so that is good. I'm going to have you go ahead and set up on the side of the bed. Okay, so at this point in time, ready? Mm-hmm. Okay. I'm going to be checking, inspecting the back, looking for any bruises, looking for any lumps, any tumors or anything like that. No swelling, no problems with any incisions back here. I'm going to have you say 99 every time I move my hands.
99.
Again.
99.
Again.
99.
Again.
99.
And again.
99.
Okay. Next, I'm going to be percussing in 9 spots posterior. Watching the scapula. So I'm going to go back and forth, down, coming here, coming out, coming over, and around. So 9 areas percussing. Then I'm going to do the same 9 areas auscultating and making sure that I'm moving my stethoscope after each inspiration, expiration. Up here, I'm getting the bronchiovesicular, and then down through here, I'm going to be having what breath sounds? Looks like a vest. Vesicular. I always say it, and Instructor Furno said that, it looks like a vest. All the way down and around. Vesicular. Bronchiovesicular, vesicular. I will not hear any bronchial back here because of the fact that you can't hear those. You have to be up around the neck area. Okay, so we did that. I'm gonna have you take a breath, chest expansion, and that was equally with that. Have you had any issues with any urinary tract infections or anything? Okay, I'm gonna be doing a soft tap back here, and so just let me know if you have any pain. Okay, so what am I checking here? Costovertebral, to see if she has any issues with the kidneys. Okay, so I'm coming around front with you. I'm gonna be just checking a few things. I'm gonna check your grip strength. No, you keep yours. Okay? Equal bilaterally. I'm gonna be checking right here. Can you, just kind of flex that. Kind of rotate out. Yep. No popping, cracking, no warmth, no redness to the joints or anything like that. Do you have any pain in the joints?
Nope.
I'm going to be checking all of her joints equally, so there's no nodules, no pain, no swelling, redness. We checked the grip strength. I'm going to have you hold your hands out. I'm going to push down. Don't let me do that. Okay, now I'm going to push up. Don't let me do that. I'm going to check that all four extremities. Now I'm going to have you do some range of motion exercises for me. And I'm only going to have you do 2 for each area. So I'm going to have you take your hands and do supination, pronation, okay? Then I'm going to have you take your arms and do adduction, adduction, okay? And then I'm going to have you do your shoulders and circumvent. And then also I'm going to have you do the inversion with them. Exversion. Okay. Neck. I'm going to have you do flexion. And then also extension. Yeah. Ankles. I'm going to have you do inversion. Exversion. I'm going to have you do circles, circumvent, okay? Legs, I'm going to have you raise, flex, okay? And toes, I'm going to have you point and flex. And then hips, I'm going to have you rotate outward and inward rotation to the hips. I think I covered all of the range of motion. Let me double check that. Because you only have to do 2 to those. Okay. So no nodules. We got the ankle, feet, and everything. Okay. So now I'm gonna lower your bed down here. You guys keeping a track on me that I'm hitting all these stuff.
Are we doing reflexes?
Reflexes? Yeah. Let me get my hammer. I'm gonna have you hold.
Okay.
Okay. So I'm gonna have her just kind of get up. I'm gonna have you walk over there and turn around and walk back toe to heel. Okay. Looks good. I'm gonna have you take and bend over. Okay, and come up. Checking for scoliosis, nothing present. I'm looking, her hips are in alignment with the shoulder and stuff, and we've already done the AP diameter. When she was walking, her hands were moving equally and swinging natural. There wasn't any discretion with that. I'm gonna have you do some things with me. I have you put your arms out. Not close your eyes. Yeah. I'm gonna have you do.
Oh, okay.
Yep, and then speed it up, okay? And then I'm gonna have you put your hands on your hips, do that. And go faster and faster and faster, okay? Perfect, good coordination there, that's good. Now I'm gonna have you close your eyes as I stand close to you. Again, normal sway will be present, but nobody, and you can and that should be no other issues with that. So we've done all of those. I'm going to have you take a seat there for me. I get to choose two of these. I don't have to do all of them. So, this is the one I really like. Because it's such a fancy tool. Okay, I'm gonna have you close your eyes and spread your fingers out and tell me if you feel 1 point or 2 point.
1, 2.
Okay, so I check all 4 extremities with that. I know it's hard, it is. Until they try it, they're not gonna know how hard it is. I'm gonna have you hold out your arm. You feel that? Okay, I'm gonna check all 4 extremities. So I did those. My little whacker. Okay, I'm gonna check your knee here. I'm gonna find your little spot there. There we go. And again, you can check all the extremities, the knees, the elbows, and stuff like that. Last thing I'm gonna do is the patella, and it's gonna be an upside J on your foot, and this is what your foot's doing as I pull that up, it curls in. So, negative Babinski reflex. Okay. So, I'm gonna take all my tools, everything that I use, clean everything. I'm gonna remove my PPE. I'm gonna make sure your bedside table's close to you. Your call bell's right there. Do you need anything before I leave?
No.
Any water or anything?
No.
Okay. So Terry will be back in about an hour. Checking on you. If you need anything, just call me. So bed's back down, lower position, curtains back open. I've already washed everything, cleaned my equipment. I'm gonna wash my hands, and the last thing is vacuum. And I'm done.